Hello, I'm Dr. Azaz from medicovisual.com back with another visual lecture, and this is the second part of peripheral nerve fibers classification. I'm so sorry for the delay. I know it has been a long time since I recorded the part first. I was somewhat busy in some of my projects, so I'm again very sorry for the delay, but here I am with the second part of this lecture series. So, before discussing the today's lecture, I will briefly have a review of the things that we have discussed in the previous lecture. So, we already talked that there are certain terms associated with the peripheral nerve fibers. So, peripheral nerve fibers, they can be classified as per one of these terms. So, for example, there may be a nerve fiber which could be, let's say, general visceral efferent. Then there can be another nerve fiber which could be, let's say, general somatic efferent. For example, here I have shown that this is, let's say, general somatic efferent, this is general visceral efferent. These are the general visceral efferent types of nerve fibers, these are the general somatic efferent types of nerve fibers. And all these nerve fibers, they may be lying, they may be inside a single type of nerve. What I mean by this is that a single type of nerve may contain, it usually, rather I should say, it usually contains more than one type of nerve fibers. Of course, there are some cranial nerves which only contain one type of nerve fibers, but all the spinal nerves and many of the cranial nerves, they contain more than one type of nerve fibers. So our focus will be that we need to decrypt the meaning of these terms. What are the meaning of these terms in a very simple way? So we already discussed these things, that we can actually divide the name general somatic efferent and so on. We can divide it into three parts. One is this one, general or special. Then this nerve fiber may be somatic or visceral. Then this nerve fiber may also be efferent or efferent. If a nerve fiber is efferent, it means it is sensory, it is taking the sensation towards the central nervous system from some organ, right? And if it is efferent, it means that it is motor and it is taking order, for example, muscle in this case. Then most important and a bit complicated part of that lecture was visceral versus somatic. We have discussed that visceral deals with visceral type of nerve fiber, they deal with deeply seated viscera. For example, the viscera of GIT, urogenital, respiratory, and cardiovascular system. And they innervate the mucosa as well as gland, and along with that, they also innervate the non-somatic muscles. It means they innervate the smooth muscles and they also innervate cardiac muscle, plus they also innervate the muscles that are derived from pharyngeal arches. Such type of skeletal muscles, such special type of skeletal muscles are innervated by visceral fibers, and specifically they are innervated by special visceral efferent types of nerve fibers, right? And we also discussed that visceral sensory or visceral efferent types of nerve fiber, they are mainly involved in sensing the internal environment or internal milieu of the viscera, right? And we also discussed that the target tissue of the visceral nerve fibers, it is usually derived from the somatopleura. Exception is the glands of the skin, and we discussed all those things using these clear diagrams, which I am not gonna explain again in this lecture. If you want to understand in a more depth, please watch part 1 of this lecture series. Again, if I start describing all these things second time, then I know many of you people will get bored and you start bashing me in the comments that your lectures are so long. So that's why I'm not gonna explain all these things again. But anyhow, I did, I think so. So, somatic nerve fiber, as I've told you, they are involved in the superficial tissues, for example, skin and skeletal muscles, specifically somites derived skeletal muscles, which are actually most of the skeletal muscles. Along with that, sensation from tendons and joints and so on, except the glands, all types of glands, they are innervated by the visceral nerve fiber. And I've told you that they are mainly involved in sensing the external environment, and their target tissue is somatopleuric in origin. By the way, here let me tell you again that somatopleura is ectoderm plus somatopleuric mesoderm, and subplanknopleura is endoderm plus subplanknopleuric mesoderm. So if a viscera is there, it is usually made up of subplanknopleura. Typically that's what is it in the embryology, right? And we also discussed that when it comes to the spinal cord, the dorsal and ventral horn of spinal cord, they are involved in the somatic type of nerve fibers, while the lateral horn, here we have this lateral horn is involved with the visceral type of nerve fibers. So now let's start the today's lecture actually, and let's start discussing the spinal nerves first. Now what I will do is that we will talk about spinal nerves as well as we will talk about the cranial nerves, and we will also discuss the so we will talk about both of these nerves, and then we will tackle one by one the types of nerve fibers that are present inside them, and we will together try to classify the nerve fibers within these nerves. So starting from the spinal nerves, it is relatively simpler and easier. That if I draw the spinal cord section, so here I am drawing a simplified diagram of section of spinal cord. So again, as I have told you, that it consists of the dorsal horn, and there is a lateral horn which is not present in every section, right? It is present at some places. And so yeah, this is the dorsal, this is also dorsal. Lateral horn, which is present at some places. I will not go into details in this lecture. And this is the ventral horn, which is also called anterior horn, right? Now what happens that, let's suppose if there is a muscle here, a skeletal muscle, and it is derived from somites, somites derived skeletal muscle, which is the common type of skeletal muscle. A nerve fiber will originate from the ventral horn. So here a nerve fiber will originate, its axon will go, and its axon, what it will do is that it will try to innervate, it will not try, it will actually innervate this skeletal muscle, right? This type of nerve fiber which is coming to innervate the skeletal muscles and tendons and what are that, ligaments and so on. Now you see that this nerve fiber is originating from the ventral horn, and it is innervating, it is moving away from the central nervous system, it is innervating this muscle. It will actually give order to this muscle that now you should move, right? So of course, first thing is that it is afferent or efferent. It is efferent, it is motor type of nerve fiber, and it is efferent type of nerve fiber. This is first thing. Second, it is innervating a somites derived structure, and it is innervating somites derived skeletal muscle. So it should be somatic nerve fiber, or it should be visceral. Again, the answer is very simple, it is the somatic type of nerve fiber. This we have discussed already, that the skeletal muscle, which are the common types of skeletal muscle which are originating from the somites, they are innervated by somatic type of nerve fiber, and efferent fibers are there. And of course there is nothing special about these, so they are present everywhere, and these are the general type of fibers. So this is the general somatic efferent types of nerve fibers that we are talking about here. Now secondly, what happens that we have our skin, for example. Here is the skin, simplified depiction of the skin, and along with that we might also be having some fiber that are coming from these muscles, taking the proprioception sensation, and of course from the tendons and ligaments and so on. Let's draw with this color, right? So these types of fibers, and from here as well, again they are taking the sensation towards the central nervous system like this, right? So they are taking sensation towards the central nervous system from the skin, from the skeletal muscle, from the tendon, from the ligaments, and so on. And what they will do, that they will be going towards the dorsal root, not root, dorsal horn of spinal cord like this. They are going here. So first thing is that they are afferent fibers, right? They are sensory, they are afferent. Second, they are coming from the skin, from the skeletal muscle, from the tendon, from the ligaments, basically the superficial, right? So they are what? They are somatic. Again somatic afferent, and again finally there is nothing special about that. So they are general somatic, general somatic afferent types of nerve fibers are there, and they are going towards the which horn? Dorsal horn. And by the way, they are taking mainly what type of sensation? They are taking touch, they are taking pain, they are also taking temperature. And I don't know why many books they tend to ignore the other one. They are vibration, proprioception, and also 2.2 point tactile discrimination, right? So all these sensation, all these general somatic sensation are carried by these general somatic afferent types of nerve fibers. Next, if I draw a viscera here, a simple viscera here, right? Now to this viscera, some fibers, they are coming from the lateral horn. This is the lateral horn. Now from the lateral horn, they will move ventrally and they will follow the pathway of general somatic efferent, general somatic efferent fibers, and then they will come here and again they will go and innervate this viscera, and they are taking orders from the central nervous system, for example to increase the peristalsis, let's say, or to decrease the peristalsis, and so on. So they are coming from the lateral horn. As we have already discussed, that lateral horn is mainly dealing with the visceral fibers, right? So and they are also coming towards the viscera, so they are visceral fibers, and they are efferent types of visceral fibers. So they are visceral and they are efferent types of visceral fibers, right? So visceral efferent, and again there is nothing special about them, so they are general visceral efferent fibers. And finally, from the mucosa, let's say here there is the mucosa of this viscera. From the mucosa, some fibers are going towards the central nervous system, and they will follow the path of general somatic afferent fibers, right? And again they will go towards here in the spinal cord, and they will go close to lateral horn, right? So they will go close to lateral horn somewhat here, right? Now here there is a misconception. Even I did a mistake in my lecture as well, that I told you that the lateral horn, it is involved in, here let's zoom. I told you that lateral horn, it is involved in visceral nerve fibers, but here is the catch. This is true for the visceral efferent, general visceral efferent. It is true for the general visceral efferent fibers that they are originating from the lateral horn. But if we talk about the general visceral efferent, I mean general visceral sensory fibers, they are not exactly going to the lateral horn. They are actually going into the dorsal horn. They are going into dorsal horn, not into lateral horn. They are going to the dorsal horn. Please note that they are going to dorsal horn, and they will terminate in the dorsal horn, but close to lateral horn. They will terminate in the dorsal horn but close to ventral horn, right? And this is the ventral most part. Some books clearly mention that they terminate at the ventral most part of dorsal horn. So this is the ventral most part of dorsal horn, basically near the origin of the lateral horn they are terminating, right? So what type of nerve fibers are these? We have already discussed, and it is very easy to understand that they are afferent fibers first of all. Secondly, they are what type? They are visceral. It's very easy to understand. Is it difficult? Visceral afferent. And again they are general visceral afferent. So general visceral afferent types of nerve fibers. And what sensations they are taking? Mainly the most important one is stretch of the organ. So stretch of the organ is single most important one. They are the stretch of the organ. Secondly, chemical changes. Thirdly, they can sense the pain, certain type of pain, which is called visceral pain, inflammatory deep visceral pain. So visceral pain, right? And some type of nerve fibers, they can also sense the change in temperature, and to some degree touch can also be sensed. And by the way, this is controversial. If you want to forget this, you can forget as well, but mainly the most important is stretch and chemical changes. These two are most important: stretch and chemical changes, and of course visceral pain as well. These three are most important. You can afford to forget these two if you want to. So these were the sensation, and the fibers were general visceral afferent types of nerve fiber. And here let me draw something for you, that what is actually happening here, where is the spinal nerve here. So if let me draw it for you first, then we will talk about that. Okay, so I love drawing on this drawing tablet. It's so smooth and interesting, right? I think I have found another hobby in my life. The other hobbies are teaching and programming and so on, and cooking as well. Yeah, by the way, I love cooking. So actually, this is the nerve. Spinal nerve. And the spinal nerve has two roots. One of the root is this one. One of the root is this dorsal root. This is the dorsal root. Dorsal root. No, this is the dorsal root of spinal nerve. This is the dorsal root of spinal nerve. This is not the dorsal root of spinal cord. Please remember that. And this is the ventral root of spinal nerve. These are the horns. This is the dorsal horn, this is the ventral horn, and these horns are of spinal cord. So this is the dorsal horn of spinal cord, this is the ventral horn of spinal cord, this is the lateral horn of spinal cord. But here is a single spinal nerve, but it is having these roots. One root is coming from here, the dorsal root, and the other is the ventral root. And dorsal root originate from the dorsal horn of spinal cord, and ventral root originate from the ventral horn of spinal cord. If you look carefully, all the sensory fiber, whether somatic or whether visceral, all the sensory fiber, all the afferent fibers, they are coming to the spinal nerve through the dorsal root, right? And all the motor fiber, all the efferent fiber, whether visceral or somatic, they are coming from the ventral root, right? So this is important to understand. Of course, we have got so much off topic here, but I think these important concepts, they are worth noting and worth remembering. If you clear these concepts, your understanding of neuroanatomy and neurophysiology will increase a lot, right? Finally, here let me reiterate that a nerve may be containing more than one type of nerve fiber. So here you can see this is the spinal nerve and it is containing different types of fibers. It is containing general visceral efferent, it is containing special visceral efferent, it is also containing general somatic afferent and efferent and so on. Four types of nerve fibers are there within a single spinal nerve. So and by the way, here the visceral efferent, general visceral efferent, and general visceral efferent, especially general visceral efferent, they are mainly the component of autonomic nervous system, which includes sympathetic as well as parasympathetic nervous system. Now let's talk about the cranial nerves, and cranial nerves has a dreaded part, that is the special type of nerve fibers. But don't worry, we will tackle it one by one and we will understand the basic concept at its core. So let's start the discussion that we are talking about cranial nerves, and from cranial nerve let's first talk about the first cranial nerve. Yeah, so first cranial nerve is which nerve, by the way? It is the olfactory nerve, right? Olfactory nerve. So olfactory nerve, as the name indicates, it is related with olfaction, the sense of smell. So here we have our nose, again Dr. Najib's style diagram, a tribute to Dr. Najib as well. So at the roof of our nasal cavity, we have this sensory epithelium that is involved in sensing the sense of smell, right? Sensing the smells. So basically smells are chemical. So if a droplet through aerosol, if a certain let's say a perfume particle, so a certain perfume particle has arrived here, this will be sensed by this epithelium, and then here there are special nerve fibers which are taking this information towards your central nervous system, and they are taking it towards directly towards the your brain. They are not going to brain stem, they are directly going to the brain, right? So first thing is that these olfactory nerve fibers, they are which type of fibers? They are sensory fibers. So naturally they are which type of fiber? They are the afferent types of nerve fibers. They are the afferent nerve fibers. Now the second and most important question is that whether these nerve fibers are the somatic efferent or whether they are visceral efferent types of nerve fibers. Now to understand this thing once for all, let's make an algorithm to classify the nerve fiber into somatic or visceral, and this is especially useful for afferent types of nerve fiber. Efferent are straightforward, you don't need to use any type of algorithm for that. So this is mainly for afferent types of nerve fiber. So let's say that if if a nerve fiber is taking the information from a deeply seated viscera, we should ask this question, that whether this nerve fiber, for example this nerve fiber in this case, whether it is taking the information from a deeply seated viscera, yes or no. So we should ask whether it is yes or whether it is no. If the answer is yes, then most likely it is visceral, right? If it is no, then it is most likely somatic. The second question that you must ask is that whether these nerve fibers are taking information from a tissue that is part of GIT, or if it is part of urogenital system, or whether it is a part of respiratory system or CVS system. The question is whether it is part of these, yes or no. Again, yes or no. Again here, if the answer is yes, then most likely it is visceral nerve fiber, and if the answer is no, then most likely it is somatic nerve fiber. Again, it's not very complicated, it's very simple and straightforward. Third, the sensation, if there are chemical senses involved, mostly, not always, but mostly the chemical senses, they are taking chemical sensations, they are taken by visceral nerve fibers. So if the answer is yes, again most likely this would be the visceral nerve fiber? If the answer is no, most likely it would be somatic nerve fiber. Then another question that you must ask is that whether the what is the embryological origin? Embryological origin. So what is the embryological origin of tissue from which this nerve fiber is taking the sensation? Whether it is it is arising from splanchnoplura, or whether it is arising from the somatopleura. Again, if it is arising from splanchnoplura, if this answer is yes, then it would be most likely visceral nerve fiber, or if it is arising from somatopleura, most likely it would be somatic nerve fiber. And finally, the last point, which is not applicable in this case, in case of first nerve, because it is going directly to the brain, this is the nuclei arrangement in brainstem. What I mean by this is that this nerve fiber, it must be terminating somewhere in the brainstem, and in brainstem the afferent nerve fibers, they terminate in some of the nuclei, right? So again here, if they are terminating with some other visceral fibers, I mean they are terminating in a column of nuclei. For example, they may be terminating in a nuclei which is present in the column of other visceral fibers. We will discuss these things later, don't worry. Here let's just write the algorithm first. So if they are terminating with other somatic, then this is most likely somatic. So this is important algorithm. Now let me write it down here that all these are pointing towards which type of fibers? They are pointing towards visceral nerve fibers. Visceral nerve fibers. And these one, all these are pointing towards what? If I write it here, they are pointing towards what? Somatic type of nerve fibers. Somatic nerve fibers. So if it is not a deeply seated viscera, then of course it is most likely somatic. If it is not part of the system, it is most likely somatic. If it is somatopleuric in origin, then it is most likely somatic nerve fiber. And with the other somatic fiber, if it is there, it's nuclear, then it is somatic nerve fiber. And here, if the answers are yes, then it is visceral nerve fiber, right? Now if we talk about this first cranial nerve, the olfactory nerve, let's try to answer these questions. Now what do you think? Is our nose and nasal cavity, is it a deeply seated viscera, or it is somewhat superficial structure? I don't know about you, but I think it's not a deeply seated viscera. Like it's not a part of, let's say, a deeply seated abdominal viscera or the pelvic viscera. So it is somewhat superficial. So I would go for no. My answer would be no. You may be thinking yes. Depending upon the perspective, again, there is no clear-cut answer to this, but most likely I think the answer should be no. So it is pointing towards somatic, right? The other is that whether it is a part of GIT, urogenital, respiratory, and CVS. Well, the interesting thing is that many people believe that the sense of smell, it is an inherent component of GIT, as well as somehow it is also the component of respiratory system, but many classify it as a part of GIT, gastrointestinal system. Our sense of perception of taste drastically changes with the smell. For example, I provide you with a relatively tasty meal, but if it smells very bad, most likely you will reject it. So it's an important part of GIT as well, and some people also consider it as a part of respiratory. So here again, although it's not a clear cut yes or no answer, but most people consider it yes, it's a part of GIT, or it may be the part of respiratory system. Thirdly, as I have told you, that they are basically the chemical sensors, the aerosols present in air, these particles, these are basically chemicals and they are sensed by these nerve fibers, these receptors here, and these sensations are carried with these nerve fibers and these nerve fibers of the olfactory nerve. So here the answer is clearly yes. They are basically the taking the sensation from chemical sensors. And what is the embryological origin? Well, I have not taught you these things, but here you just trust me that it is somatopleuric in origin. It is ectodermal in origin basically. So it is somatopleuric. Or should I show you an animation? I think I should show you an animation real quick in Blender. So let's go to Blender for a quick animation. So here is the 3D model from our lecture on the topic of face development, and in that lecture we had discussed that we have the formation of these nasal prominences or nasal processes. They are also called nasal processes. So basically here we have the lateral nasal process. This is the lateral nasal process, and this is the both of these are the medial nasal process. And by the way, all the processes, they are going on side by side. In the spinal cord as well, we have those spinal nerves at both sides, right and left as well, and we also have, of course, the ventral and dorsal root of those spinal nerves on both sides. So bilaterally they are going on. Sometimes I just show on the one side, but please don't get confused. So anyhow, lateral nasal process and medial nasal process, between them here is this thickening of ectoderm, outer layer. This one is the ectoderm. So here we have this thickened ectoderm here also. This is the thickened ectoderm, and from this thickened ectoderm, again I am focusing on ectoderm, from this thickened part of ectoderm the nasal cavities will arise, and this ectoderm is actually, thickening of ectoderm is actually called nasal placode. I don't know how to pronounce it correctly. Placode, yeah, placode, nasal placode. I checked again on internet, so it is nasal placode. So anyhow, what happens that from this nasal placode, uh, let me show you again here, let me show you the animation, that these nasal placode, they will invaginate inward, they will grow inward, and they will grow process inward. Here if I go inside, they are flat here. So if I see from inside, they are growing inward like this. So you see they are growing inward, and they will then combine and they will form the nasal cavities. Between them nasal septum will form, and so on. I will not talk about those details here. My aim was to just make you understand that the nasal cavities and of course the nasal epithelium on its roof, here is the roof, on its roof the nasal olfactory epithelium will develop. So all these structures, they are actually arising from the ectoderm. So ectoderm is the part of somatopleura. So now let's close the Blender, and now let's go to our concepts app and let's understand it further. So we were discussing that the embryological origin of embryonic epithelium is somatopleura. It is basically the ectoderm. And nuclei arrangement, this fifth part, it is not applicable in this case because they are not going into brainstem. They are going directly, these nerve fibers, they are going directly into the cerebral cortex. We will discuss details in neuroanatomy, not in this lecture. But anyhow, yeah, here we also highlighted that it is yes. So anyhow, here the things are becoming very interesting. So I said that it is not deeply seated visa. So these 2 points, these two, 1 and 2, these are pointing towards somatic, and these two, 1 and 2, they are pointing towards visceral. So that's confusing. Now what we should do here, whether we should label these nerve fibers as visceral or whether we should label these nerve fiber as somatic. Well, even the scientists are confused. So that is why in many textbooks you will see it's written somatic, and in other textbooks you will see it's written visceral. And interestingly, let me tell you a funny thing, that even in the same textbook, for example, I am looking at you, Grey's Anatomy, even in the same book, at one place they will say these are the visceral afferent fiber. Basically, these are the special visceral afferent fiber. At one place they will say they are special visceral afferent fiber, and then they have drawn the table, and in that table they are saying these are special somatic afferent fibers. So I know my dear students get confused, so that is why I went into a bit of depth of the situation, and I am explaining the concept to its core so that you do not get confused. Now final question is that whether they are general or whether they are special. Of course they are special, my friend. You cannot smell with your hand, or you cannot smell with your tongue, for example, or with your leg. So these are special sensory organ, these are rare, they are not present everywhere. So in a nutshell, in a summary, we can say all this discussion was to understand one thing, that we have one type of nerve fiber in our olfactory nerve, first cranial nerve, and this single type of nerve fiber, they are special afferent fiber, and we do not know whether they are special somatic or special visceral. Some authors consider them as special somatic afferent, while other authors consider them as special visceral afferent fibers. And by the way, in my observation, the visceral is more common. Most of the authors, most of the textbook, they classify them as special visceral afferent types of nerve fibers. So this is more common type of classification of these nerve fibers. In my opinion, it's a tie. You can either call them visceral or you can call them somatic. And I've told you the reason. Now let's talk about the second cranial nerve. Yeah, so let's talk about the second cranial nerve, which is the optic nerve. Second cranial nerve is the optic nerve, and it is taking the information from. So here is a very simplified depiction of the eye, and here is of course our cornea. I think it has become keratoconus, so let's correct it. So yeah, it's not a very beautiful diagram. So anyhow, you can understand that here is the retina. So here we have our retina, and from retina the nerve fibers are arising from the ganglion cells, and they will be ultimately forming our optic nerve here. So here they will be forming the optic nerve, right, and then they will go to the brain, and I won't tell you where they are going into the brain. That is topic of another day. So anyhow, this is the optic nerve. Now how can we classify this? First thing first, that it is the afferent nerve. It's very simple and easy to understand. It's a sensory nerve, purely sensory nerve, and the only type of nerve fiber, a single type of nerve fiber, which are afferent type of nerve fibers. Now whether they are visceral or somatic, to answer this question, let's bring our algorithm back here. So here is that algorithm. Let's let's put it here. So now again the questions, let's question ourselves that whether the eyes, and specifically I'm talking about retina, whether they are deeply seated viscera or they are superficial. Well, they are not very deep. So again my answer would be no, they are not very deep. Second, are they part of GIT, urogenital, respiratory, or CVS? No, they are not part of any of these systems. So clear answer is no. No, no. And are they sensing some chemicals? Well, technically everything is chemical. Photons are also chemical, but they are not typical type of chemical. So these are basically physical sensors. Light is physical entity, it's not a chemical entity technically, I think. So answer should be no. Then embryological origin, we have discussed the details of development of eye, and eye originate mainly specifically from the ectoderm, neuroectoderm. So it's a somatopleuric in origin. And nuclei arrangement, again it is again here not applicable. So it's very simple and straightforward. I am happy to see this. So all these points are pointing towards one thing. All these are going towards somatic. So the simple and straightforward answer to this is that they are somatic afferent nerve fiber. And again, you cannot see with your leg, you cannot see with your hand, you can see with this special organ called eye, and it's rare. You have only two eyes, right? Normally you only have two eyes, so that is why it's a rare organ, and that is why we should consider it special. So it is simple and clear cut special somatic efferent, not efferent, afferent. Special somatic afferent types of nerve fibers are making the second cranial nerve, the optic nerve, the second cranial nerve. Again, it's very simple and straightforward, right? So now let's talk about the third cranial nerve. Yeah, so third cranial nerve is oculomotor nerve. Oculomotor nerve. Now, oculomotor nerve, it supplies all the extrinsic skeletal muscles of the eye except two. All the extrinsic skeletal muscles of eye except two, and these two are lateral rectus, which is supplied by fourth nerve. Sorry, not fourth nerve, it is supplied by sixth nerve. And the other one is superior oblique, which is supplied by fourth nerve. Well, there is a mnemonic to remember it: LR6SO4. LR6SO4. Superior oblique from the fourth cranial nerve, and lateral rectus from the through the sixth cranial nerve. Besides these two, all the skeletal muscles of the eye, all the external extrinsic skeletal muscles of the eye, they are supplied by oculomotor nerve. So one type of nerve fibers that constitutes the oculomotor nerve are those that are supplying these skeletal muscles. Naturally, they are afferent types of nerve fibers. They are afferent types of, not efferent, not afferent. I don't know why I mispronounce it. Efferent types of nerve fibers. Second thing is that these extrinsic muscles of the eye, all the extrinsic muscles of the eye, they are derived from the somites, specifically occipital somites, right? So they are derived from somites. So naturally, the skeletal muscle, it's a very simple and straightforward rule that the skeletal muscles which are derived from somites, which are most of the types of skeletal muscles, they are innervated by which type of nerve fibers? They are innervated by somatic type of nerve fiber, not visceral but somatic type of nerve fibers. And finally, I think I disagree with this, but everyone believe in the scientific community, everyone believe that there is nothing special about the muscles of the eye, so they just label it general somatic efferent. I think they are special one. I think this should be special somatic efferent, but anyhow, everyone calls it general somatic efferent nerve fibers. This oculomotor nerve, it is also harboring another type of nerve fibers, and these type of nerve fibers, where is this diagram? So these type of nerve fibers, they are basically involved in innervating the sphincter pupillae muscle. Well, actually, here is a muscle called sphincter pupillae muscle. When it contracts, this pupil constricts, so less light enters here. Now, this muscle is myoepithelial in origin, similar to glands, similar to muscles of the gland. This muscle is myoepithelial in origin. This is myoepithelial in origin. So that is why, just like all other glands, all other glands and their musculature, they are innervated by what type of nerve fiber? They are innervated by visceral type of nerve fiber. So that is why even technically this, I think this should not be visceral, this should be somatic, but still they call it visceral. The fibers that are supplying the sphincter pupillae muscle, they are visceral efferent. Visceral efferent. And I will tell you another reason for calling them visceral efferent rather than somatic efferent. I want every one of you to have a very clear concept, so you should not get confused. So I am telling you from every angle, from every aspect, so you do not get confused. Actually, the sphincter pupillae muscle, they are part of autonomic nervous system. Actually, when you are relaxed and when you are having a good time, the sphincter pupillae muscle contracts. If you are afraid, suddenly you see something dangerous, for example, you see a dangerous animal, let's say a lion coming towards you, suddenly our pupils dilate. This is because the fight and flight response kicks in. There is the sympathetic nervous system. I will not go into details. That what happens with the help of that is that sphincter pupillae muscle is inhibited. So dilator pupillae muscle activates and pupils dilate. So basically all these are the parts of autonomic nervous system. And we have discussed previously when we were talking about the spinal nerves. Here we have discussed that the where is that the autonomic nervous system. We discussed that general visceral afferent and general visceral efferent, especially general visceral efferent, they are mainly the part of autonomic nervous system. Most of these nerve fiber, I think all of the nerve fibers in this category, general visceral efferent, all of these nerve fibers, they are autonomic nervous system. So because mainly of two reasons. One is that they are myoepithelial like glands, they are gland like myoepithelial, and similar to glands, their muscles, they increase or decrease the secretion, but in this case they increase or decrease the entry of light into our eyes. So they are similar to glands, somewhat similar to the muscles of the glands, right? So they are myoepithelial in origin. Secondly, they are part of autonomic nervous system. Because of these two reasons, they are considered as a part of visceral. These nerve fiber are considered visceral rather than somatic. So they are general visceral efferent. Last thing that I wanted to tell you, another irony is that these myoepithelial cells here, they are ectodermal in origin. Again, here is a contradiction. So ectodermal in origin, ectoderm is the part of somatopleura. In this sense, we should somehow classify it in the somatic category, but again, due to these 2 points and some conventions of our dear scientists, they still classify it under general visceral afferent type of nerve fibers. So this was about, we discussed first three cranial nerves, and now the fourth cranial nerve and sixth cranial nerve as well. We will talk about both of them together because it's very simple. So just like the extrinsic muscles of the eye, other than these two, they are supplied by third cranial nerve. If we talk about fourth cranial nerve, what is the name of fourth cranial nerve? It's called fourth cranial nerve is the trochlear nerve, and it has only single function, that it supplies this muscle, superior oblique muscle. And superior oblique muscle, like all other extrinsic muscle of the eye, extrinsic skeletal muscles of the eye, this is also embryologically, it is also somatic in origin, somatic in origin, not somatic, somatic in origin. It arises from the occipital somites and it is the skeletal muscle. So that is why these fibers, again, they are termed as general somatic efferent. It's very simple. And the sixth nerve as well, I am skipping the fifth nerve for now. Sixth cranial nerve, which is the abducens nerve, it is also supplying a single muscle of the eye, that is lateral rectus muscle, LR6. Remember this mnemonic, LR6. And again, we have discussed the rationale previously that these nerve fibers are also general somatic efferent nerve fibers. Now, a little bit more complicated one is the fifth cranial nerve. So, fifth cranial nerve, which is the trigeminal nerve. It has three parts. We will not go into those details, but mainly it has two components. It has a sensory component, which is taking sensation, from most of the part of head and neck region, almost all, most of the head and neck region, head and face region mainly, right? So yeah, general sensations basically, and these sensations are from the skin and other superficial tissues. They are the touch, pain, temperature, vibration, and so on, these general type of sensation. And we have already discussed when we were talking about the spinal nerves that they are afferent. First they are afferent, it's very easy to understand that they are afferent. Then they are somatic. We have discussed it previously that they are somatic afferent, and again there is nothing special about them, so they are general somatic afferent. Now the other, this is the sensory component, and the other one is the motor component of trigeminal nerve. And motor component of trigeminal nerve, it is actually innervating the muscles that arise from first pharyngeal arch muscle, which include muscles of mastication and the one of the ear muscle, very important, tensor tympani muscle. So muscles of first pharyngeal arch. So we have already talked that non-somatic muscle, which includes the skeletal muscle derived from first pharyngeal arch, they are innervated by efferent nerve fiber. And which efferent nerve fiber? Not somatic but visceral. So they are innervated by visceral efferent, and because these muscles are very rare in our body, so they are special visceral efferent, SVE, special visceral efferent type of nerve fibers. One of the reason, again I am going a bit into the philosophy so that you do not get confused and you remember these things. Basically, it is believed that the pharyngeal arches, they evolved from fishes. In fishes, pharyngeal arches are very important structures, so they evolved from fishes. And in primitive fishes, these pharyngeal arches, they do not form such sophisticated type of muscles that are present in our bodies. For example, in our bodies, the pharyngeal arches, they are also forming the muscles of ear. Ear is not the part of viscera technically, so this does not hold true for our bodies, but in fishes and other small animals, these pharyngeal arches, their muscle, they strictly remain visceral. They remain the component of viscera, they remain the component of gills basically. In fishes they have gills, and gills are the part of respiratory system, important component of respiratory system. So basically they are forming the respiratory system, they are forming the muscles of respiratory system of the fishes. But in human, they are not technically forming only the pharyngeal muscles. They are not technically forming only the pharyngeal muscle, they are also forming the muscles of ear. But still that convention is respected, and we still consider them visceral fibers. So that was another philosophical debate. But here, let me tell you that some scientists want to make our lives easier. So rather than confusing people with this special visceral type of the classification, they simply call it that we should call them brachiomotor fibers. Brachiomotor, I hope I am writing the spelling correct. Brachiomotor efferent fibers, or simply brachiomotor fiber. Brachio means branchial arches, from branchial arches. So they are motor fiber. You don't even need to write efferent because motor is here. So they are brachiomotor fibers. Brachiomotor fiber. It's very simple and straightforward. So now many literature, they avoid this confusing terminology of special visceral efferent. They do not say that the muscles of pharyngeal arches are special visceral efferent. They are innervated by special visceral efferent nerve fiber. They simply say that they are innervated by their their own type of nerve fiber, which is the brachiomotor type of nerve fibers. So fifth cranial nerve is having mainly two types of nerve fiber: the general somatic afferent fibers, which are carrying the general sensation from head and neck, and the other one is special visceral efferent, or we should rather call them, let's not call them special visceral efferent, we should call them brachiomotor fibers, which are supplying the muscles of mastication and other muscles that originate from the first cranial arch, including the tensor tympani muscle. So that was about the today's lecture. We have discussed the spinal nerves and first six cranial nerves today. So I hope you are very clear about this. In next lecture, we will talk about the other six cranial nerves. We will talk about 7th, 8th, and so on up to 12th cranial nerve. So that was about today's lecture. Thank you so much for watching this video.